Houndara Shumai Pope. Hello everybody and welcome back. It's great to see you all, virtually of course. I don't know about you, but I've just come out of an amazing breakout session over the lunchtime, and I hope you've all enjoyed your sessions as well. I think for me it tops off what has been a truly magnificent set of speakers through the day. So I'm just going to say a couple of things now, a couple of reflections, and then I'm going to have the, sadly, I'm going to have to close the session for today. So I've just been talking to Rachel, one of our colleague organisers, and I'm aware that apparently there were about 300 of us on the line this morning. So that's absolutely fantastic. And it's just, I think it just sets out the reach that we've got when we do these conferences virtually. So thank you to everybody who's participated and been online throughout today so far. I can't actually believe that it's my job to close day one already, because it's simply flown by. I think for me this has been an incredible first day. I think there's been a huge amount of stuff to digest. Lots to think about, starting with Dean this morning with some of the challenges into the system and some of the provocation, activist stuff that he was talking about. Some really important messages there in the things that he was saying. And then we moved on to Helen, and Helen's sort of recipe, as I would call it, her 10-point recipe or agenda for change looking forward. That was incredibly interesting as well. And for me, being less familiar with Helen's work, hugely insightful. So again, I think, there's a lot for us to think about, a lot for us to reflect on, and a lot for us probably to follow up. One of the themes from those sessions this morning, and also in the words that I spoke at the opening of the conference, was actually just about, the power of collaboration and collectiveness. And I know one of the sessions over the lunchtime, which Will ran, and would have focused a little bit on that, and Michael West's work and the King's Fund. And I think that's just been an incredibly strong theme. And one of my reflections then around that collectiveness and working together was just about, the role that HPMA brings, or plays rather, in bringing us all together. It's about a decade since I got to hear about HPMA in my government role and started working with many of you and many of the people on the call. And I just see it as a hugely supportive and collaborative community, and a community which is always willing to share best practice, to learn from each other, and also to sort of offer help and support. So I just think some really strong relationships, and I just think, the tone of the speakers this morning has helped us reflect on that, and the HPMA have done a fantastic job in pulling the sessions together. So I just wanted to sort of say formally some thanks to all of the speakers who, as I said this morning, have taken time out in what is an incredibly busy time for our workforce and our profession in particular. Speakers from Dean to Helen to Tom, and then in the breakout sessions, we had Cheryl, and that's the session that I joined. So thank you, Cheryl, for that. Jenny and Laura, Will, and then David. One of my team has actually said, David, that we're going to be stealing with pride some of your ideas from your breakout session around data. So be warned. We stole with pride from colleagues in the collective community of practice around leadership, and now a year and a half later we're motoring. So yes, we'll definitely be in touch. So thank you to all of those speakers that we've named. I also wanted to say an enormous thank you to our exhibitors, and also the sponsors for our breakout session, Locum's Nest and the Liaison Group. But most of all, I wanted to say thank you to Nikki and HPMA colleagues for inviting me to chair today. I was due to chair one of the sessions in 2019, and unfortunately, due to personal circumstances, I had to pull out. So you can imagine that I was absolutely thrilled when I was asked to chair again this year. A little bit disappointed that we're not having a party in Belfast. I'm not sure if I'm allowed to say that, but HPMA for me is full of fond memories of awards and parties, as well as the conference. And that's part of the networking and the relationship building that Helen talked about earlier. So hopefully in 2021, we'll get an opportunity to meet in person. But I just think that today has been a fantastic exemplar event and an example of how to do things virtually. So thank you, as I say, to Nikki and to HPMA colleagues for inviting me to chair today. It has been an enormous honour and a privilege. good luck for the rest of the conference. I am hoping to join you for elements of it tomorrow, vaccine permitting. But if I don't manage to do it, thank you, well done, and good luck. So the only thing that's left for me to say is to hand over to Nikki Ingham, who will be introducing the event partner session this afternoon with Selenity. Thank you, Nikki.
Hi, can you hear me, everybody?
Yes.
Hi, thanks for that, Julian. Thanks for chairing our conference today. What an amazing day it's been so far. So hopefully you can all stay on and listen to our guest from Selenity. I didn't realise what time it was. I was having too much fun in Will's session around compassionate leadership. Welcome to this last session of today with our amazing partners and sponsors, Andy, Shettle, sorry, from Selenity. He's going to introduce himself when he's ready, so I won't say too much about him, but we're here to do a session really to talk about employee relations, and it would be remiss of me if I didn't mention the research that we recently published on employee relations during COVID, which we did in partnership with Selenity, CMP, and the guy from the University of Sheffield. Great findings in that research, and we'll be doing another session in January, so just make a plug for that to talk a bit more detail about that. So without further ado, if Andy's ready, I'll hand over to Andy. He'll introduce himself and tell us all about employee relations and how we can improve and use the information. Thanks, Andy.
Hi, thanks, Nikki. I'm just checking you can hear me okay. Excellent, thumbs up, brilliant. Hi there, everybody. Thanks for the introduction, Nikki. My name's Andy Shettle. I'm a Senior Product Manager at Selenity, focusing on ER Tracker. So a very little bit about my background. So I've worked in the NHS predominantly to start with in my early days after university, predominantly working with HR systems and analysis, and now I'm working, I suppose, with both of those now, both the analysis side and the systems side. So it's just great for, I suppose, from my perspective, better sit from both sides, from the customer side and the technology side. So I'm just going to go ahead and share my screen, which hopefully should be straightforward. So please bear with me a second. Okay, I'm hoping we're going to see the full screen for everybody. I'm not 100% confident you will, but just try that once more. There we go, perfect. So I mentioned a bit about myself. So what we'll do, briefly look at the agenda, which we're going to cover off today. So we're going to look at the employee relations case management landscape, touch on the current climate, which is mainly focused around COVID, which is probably, I think, been a bit of a topic today so far. Touch upon business strategy and then data-driven approach to improvement. So please do ask questions in the chat while we're going through, and Nikki will pick some of those up, and we'll go through those towards the end. So a lot of what we'll be talking about today is observational research. Nikki mentioned about a piece of research that CMP, ourselves at Selenity, and the HPMA conducted around employee relations and COVID-19. So a lot of what I'm going to be talking about doesn't directly relate to that. It's more the observational side of things that we've picked up over the last 6 months or so. So on my first slide, it sort of lays out the employee relations landscape, how we see this typically from when we first meet a prospective customer. So I think there's probably two standout numbers here, at least for me anyway. And probably about 70% of prospective customers we first meet, they use spreadsheets to manage employee relations cases, which is no real surprise, no real shock at all. There's perfectly good reasons for doing so around Excel is pretty much free. It's on everyone's computers, and people know how to use it, so adoptability level is high. But the other one that's probably, while it's not as high, is probably quite alarming, is 15% of organisations don't really have a formal system for managing employee relations cases. No, it is paper-based, it's individually based, it's each HR professional managing things on their own, maybe using paper shared folders, nothing formalised. This is how we do it here, sort of thing. So that's probably the most alarming one. And then a few others, generic case management systems, IT help desk, and very rarely again ER case management software is already in place when we see prospective customers. But majority of the time, spreadsheets, no real surprises there. But 15%, I suppose, is probably the alarming number on that slide. So a little bit about a background that we describe, how we describe systems. So we describe whether a system is an active or a proactive system, and by active we mean you have to go and look for something. For example, you have to actively go and find something, actively look for it. Everything's more manual, logging information, logging cases, managing them day to day. It's all active. Whereas proactive is, it's there, the system is there shouting at you, advising you, you have to do this. It might be sending you a reminder email, it might be prompting you on your screen what needs to be done. So we talk about systems, whether it's an active system or a proactive system. And then we break it down by another a couple of factors. Is it flat information or is it multidimensional? So, starting with flat information around things like what was the outcome of a case, who's involved, the start and end date. So very basic, high-level information, nonetheless essential information, but it's not very detailed. It's fairly limited. We can't draw many conclusions from that. But when we start factoring in more detailed information for things like what were the outcomes of every stage, like in informal stage, investigation, hearing, appeal, what were the outcomes throughout? So we're delving down a bit deeper now. How long do steps and stages take? Are there reasons for delays? So we're starting to build up a richer picture now of information. What were the opening reasons? What's the allegation about the case? Any time and cost involved? And then we want to start learning more about who's involved in it from an employee perspective. Where do they work? What's the department? What's the structure? What's the employee demographics? Again, it's something very important in the public sector, but also for managing cases. Who are the employees involved in the case? Are there any demographics that we should be reporting on to start capturing this information? So we're trying to build up a richer picture. So the reason we talk about those two is that we want to sort of start plotting in where do they sort of fit, where do we recommend things. I think like a manual system is never going to be active and it's going to be very flat just by its nature. So again, bottom left, the spreadsheets again have its advantages but probably more disadvantages, and then we move towards the top right where we're starting to find systems that are giving more information proactively and more multi-dimensions in reporting. So it gives you a bit of a feel for where we sort of feel the different system offerings sit within the landscape. So I mentioned about majority of organisations use spreadsheets for managing their cases, and again, to keep there, plenty of good reasons for it. But I think people are quite often a bit daunted by making a change from a system like a spreadsheet to a more of a bespoke specialist system. There's been a lot of upheaval. When we talk to people and we explain it's a bit of a journey, once the system's implemented, you can start then your journey of analytics and starting to build up your information. And it's quite interesting when we do demonstrations, people tongue-in-cheek say to us, but once people start getting a flavour for the information, they want more and more and more, which is a very good thing. It's a good thing, but there's always that nervousness. And once you give somebody that, they want a bit more and a bit more. But some examples of information that we talk to people about, that starting in the top left. Most organisations probably provide this as by default every month or so, the number of cases open, close, and a month end, so we can start tracking the volumes. And then moving around clockwise, we've got the top 5 disciplinary reasons, for example. Again, people quite often have this information in spreadsheets, but then we start going to the bottom 2 graphs, and what we're trying to look at here is we're trying to we've got our factual information, the top two, just factual information. And what we're trying to do, the bottom two, is actually say, right, if we have an employee going through a process, be that a disciplinary grievance, sickness, performance, or whatever it may be, we want people to go through that process as streamlined, as effortless, as without all the worry about things, as make it as streamlined as possible. So if we look at the bottom right, this is, for example, the average number of days to complete a disciplinary. So in August, it was like 54 days, and September it had gone up to 56, 57 days, and so forth. And what we can see is here an increase in our trend is going upwards. And what's quite important here is we can start seeing things like how long on average does a case take? Does it look like it's increasing? That's going in the wrong direction. We want employees to have, a good experience of going through a process, and I appreciate it's not always a positive, happy process, but we do want to do our best to try at least make it streamlined and as stressless as possible for those involved. And then the bottom left, we're starting to look at, well, if we've got our internal SLA, we want this to see all grievances or all disciplinaries completed within 50 working days or whatever it may be. We can start monitoring, are we within our SLA, are we breaching? So we can start getting a feel, are we performing well or not? And obviously we want the greens and things like that. There's often reasons why cases take longer and stuff like that, because obviously there's people involved and we can't predict everything. But the idea here is that we want to start not just getting the factual information like the top two, the volumes of cases, which is the more traditional. We want to start looking at how long are our cases taking, are we within timeframes, how are we performing? We want to come across as being caring and compassionate about managing these cases, and having this information is part of that journey to try and to bring improvement around. Moving on to my next slide, so the current climate. So I think how do people track and manage their case load. We can't get away from the pandemic that started early in the year in this country, and getting the second lockdown at the moment, in the second wave. It's been hard for everyone professionally and personally. It's been a real challenge, and we've spent quite a lot of time working closely with our customers this year. We do every year, I should say, but probably more so this year, making sure we remain close, agile, and helping where we can with our customers. And we've had many conversations, picked up along the way, information that they've fed back to us. And I think it's very fair to say customers started seeing a reduction in their caseload from February, and a lot of organisations put a lot of cases on hold, except in the most maybe serious cases where maybe a dismissal or something involved. They put a lot of cases on hold to deal with getting organisations ready for the first wave. And a number of those cases that were put on hold have picked up in again June, July time. And so I think people have fed back to us is where they've had maybe grievances raised for lockdown in February time. Before that, maybe an employee-to-employee grievance. Well, actually, because of COVID, teams have started working closer together with a common purpose. Some of those issues that existed before have now actually, are not such an issue any longer, and the cases have disappeared. So again, there are some, very small, unfortunately, big scale. There are some benefits that have come out of the COVID. It has brought teams closer together in certain instances. And again, cases more recently being deferred a bit to help organisations prepare for the second lockdown and the second wave that's upon us. So yeah, quite a few reasons why there will be a spike, or there was a spike, and likely to be maybe a slightly smaller spike occurring with caseloads as cases were put on hold during the first wave, picked back up, again put back on hold. And a number of customers said that they're anticipating that there will be maybe more from our commercial customers that there will be some cases being raised with how furlough was handled, how reorganisation was handled as well, that people may have been maybe disadvantaged or whatever. People may feel aggrieved by that, so people are thinking there'll be an increased caseload around that. Obviously, there's going to be a massive increase in caseload around absence and maybe PTSD as well coming out of that. So there's certainly going to be cases that may not have been raised yet that may well become raised. Flexible working requests, again, I'm trying to find some of the positives out of it. I'm quite a glass half full sort of person, but one organisation I spoke to, and this was a commercial organisation of ours, their approach to flexible working was, if we can't offer it to the whole organisation, we're not going to offer it to anybody. But now that has been forced, the feedback I'm getting is that they're a bit more receptive now to having people working flexibly, maybe working at home a couple of days or permanently. People are finding it that not having to drive, train, bus or whatever to the office, there's a time saving, there's a cost saving, people have a better work-life balance. So there may be, a benefit coming out of this, with people wanting to work more flexibly and stuff like that. And other feedback we've had is that people aren't so much now in an office. You may start at 9 and finish at 5 for traditional office hours. You may, now people will be working at home, you don't see them come in and finish, but people are being more judged on their output. Are people delivering what we'd expect them to do? So instead of being watched and managed by the hours you work, they're managed by the output that they produce. So I think there's some real good positives coming out of the dynamics that have changed in the working environment. And then again, reorganisations, maybe less so in healthcare, possibly, but restructuring organisations to remain responsive and viable. Again, we're finding people are picking up the number of cases around there so they can go through those processes. So business strategy. So how does employee relations case management feed into business strategy? So we work with customers across the public sector, so very heavily in healthcare, central government, local government, commercial, private, charities, education. So a very, very broad to the system's flexibility. But virtually always, the reason we go to meet a prospective customer in the first place is that a need has been identified, which has been triggered by some sort of event leading or needing to lead to some form of transformation. So probably the most common ones we come up against is, one of the most common ones is poor controls for absence management. So customers have had their business case approved just by saying we will keep tighter controls around managing absence. And I don't mean by that getting people back to work when they're still coughing and spluttering. I mean that if we say we'll do something in 5 days, or we'll have to invite them in, or we have to do a referral to occupational health, we will do that within the timeframes laid out in the policy. We won't leave it for 7 days or 8 days. And if that role's been backfilled by bank or agency, then there's obviously maybe a double payment of costs associated. Therefore, their return on investment is, if we can get people back to work quicker by achieving our process, we can then have a direct saving of money. Colleagues at Selenity, we call employees, we call them colleagues. So people generally now go on Twitter, buy things online, people want quick responses. It's just that sort of mentality people are getting into now. It's the want it now sort of thing. No difference at work. People want answers, people want information. So people want a system to improve colleague care. People want a better level of service. So I phone up asking for an answer. I sort of expect people to give me one on things, not always straight away, but on certainly quite often now you want answers when you're on the phone. So there's certainly a dynamic change that people want things, quicker information and processes to be followed with an outcome in a shorter time frame. Cultural changes, maybe there's a bullying or harassment culture in an organisation, and they want to try to seek to reduce that occurring and try to improve upon things. So by having a system increases transparency and consistency, which is helping. So I know some of our customers have had that sort of information reported publicly, and this is why they want a system. They want to improve those areas. Engagement, are there pockets of disengaged employees? Again, trying to capture information around your caseload. You can start identifying, are there hot areas in the organisation that needs attention, that something's not quite right. Probably the most common one, reason we get invited in to meet customers or prospective customers, is lack of reporting capabilities. We may go into a meeting and say, so what's the volume of your caseload on average in a year maybe? And people don't always have that ability to answer the question, hence why they need a system. So that's probably the biggest driver, is lack of reporting. People want more information. information's everywhere now, and people want it further on their employee relations information. And I mentioned on the previous slide, probably more recently now, people are using it to track organisational change from like initial consultation through to maybe a redeployment process. So out of those, probably the absence management and reporting are probably the most common reasons people call us in, sometimes around transparency, trying to increase transparency and consistency of managing cases as well. So a data-driven approach for improvement. So no surprise this, often information doesn't tell us what the problem is. It's just highlighting that we need to spend some time further analysing, doing a deep dive. So if we find that males aged 18 to 24 in a certain department, there's a high number of grievances or a high number of sickness in a particular area, why is that? So we start looking into it a bit further. What we find is actually all those people reporting to the same line manager. So we don't again have an answer, but we may start looking at, is the line manager maybe the issue, or is it the 20 employees? Again, or is there an engagement issue between the two? So it doesn't always tell us the problem, but we can start delving, looking into it further. Has a particular business unit got higher sickness or performance cases than other areas? Why is that? So we can start looking at this information to give us the where do I need to go next to do a deep dive. Something that I've noticed in the last year or two is clients now are opting for capturing their lessons learned. They want to start becoming more efficient, better at what we do, better at serving our customers, our colleagues. So for example, if I managed a grievance case, I might think, you know what, if I did this again, how would I do this better, or what worked really well, and then have feedback meetings within the wider team. It can all be done remotely, it can all be done via Teams. We can start sharing and disseminating what we can do to become better at what we do to manage our colleagues. So, a big driver for improved case management, as I mentioned, is always the desire to have more information available. People want more visibility, more information. You can make better decisions with more information typically. So monthly board reports, what's going on in the business relating to people. So traditionally you'd have turnover, sickness, stability, who's in post vacancy rates, bank agency fill rates and so forth. And then if we start breaking it down as the examples I gave, we start looking at the employee relations, how many sickness cases, how many grievance, how many disciplinary, what's the climate in the organisation? Do we feel that we've got a lot going on with our employee relations? CEOs are wanting more information to make informed decisions. They don't want to make decisions without all the facts, without the information. And start comparing ER information with company performance information. So do we find that by having high performance issues and sickness, does that cause issues maybe in clinical care? You probably would do because you haven't maybe got as many people around if they're off sick or so forth. But it's obviously going to be a clear correlation in some examples, maybe not be so clear in others. But again, the more information, more we can start comparing against other data sets. So a brief summary of what I've covered. So organisations at different stages in their case management journeys, no one should be ashamed of saying we use a spreadsheet and it works fine or it doesn't work fine or whatever. Everyone's at a different stage of their journey, and there's obviously, I'm sure, with the right systems, more that they can be getting out, some more information can get produced. There's a growing desire to provide improved colleague customer care. We want to do more to have engaged colleagues who look after them, treat them with respect, going through a process. Often the information doesn't tell us what the problem is, but it's like the first warning light. It's a highlight to us that we need to go further into the data, start understanding it further, to review it and maybe start drawing conclusions. And as organisations evolve beyond crisis management that we're in at the moment, what we've done, or what organisations have done during this, has been amazing. And what would be great is if everyone can go through a sustainable transformation for the future. So get systems into place that are going to drive sustainable transformation moving forward. So that was the areas I was covering off today around employee relations, the landscape, some of the observations that we've picked up. Obviously, welcome any questions that you've got or thoughts that you've got. I've got a couple more slides I'll go to in a minute, but Nikki, over to you if you've got any questions that have come up.
Yeah, there's a question in the chat from Abayomi. Do systems generally track internal management capability and availability to conduct cases, as that can be one of the biggest challenges to get cases completed effectively and efficiently? So you mentioned about the system, the data it carries. The question is about, does it track the capability and availability of management to do cases, conduct cases?
So the system can be set up to capture, not say people's availability, but it can certainly capture who's involved in hearing the case, for example. You could look at reports and say, do we use the same people continually to hear and investigate reports? So it can certainly capture the key people involved in it. Won't necessarily tell you everyone's availability, but we can certainly look back and say this person's been used for the last 10 cases or so to try and share it around a bit. And if you do find that you're getting, for example, delays to cases because you don't have sufficient hearing officers, investigating officers, you can then extend the case and put the reason in, so you can start building up your intelligence. So, for example, if after a 3-month period you analyse why there are delays to cases, if one of the big reasons or big blockers to progressing cases in a timely way is due to lack of availability, then you've got that insight, you've got that fact to say, this is the reason for blockers, it's down to lack of availability. The next step is, what can we do? We've got the fact, what can we do now to hopefully unblock that? That's obviously a wider piece of work to unblock the resource there.
Okay, thank you. Interested, talked obviously a lot about COVID and its impact, and you've had a lot of feedback from your customers during the pandemic. So can you just, I suppose, expand on how your relationship with your customer works?
So typically it works, we have account managers, so the account managers will liaise with customers on a frequent basis, maybe catch up with them every 3 months or so, see how things are going, but they're always there to be contacted as and when required. So earlier in the pandemic in April time, a number of customers that I've had built a relationship up with over the years, I've just emailed them, checked in, see how things are going and stuff like that. Is there anything we can support with? So I think this year I'd say it's probably more exceptional in that we've gone that extra mile to stay in touch even more so with customers, assisting them with things like managing COVID in the system and stuff like that, getting things set up quickly for them. So we've done what we can there, but routinely the account management team love speaking to the customers, getting the feedback and trying to assist them through any challenges they've got that we can, within reason, solve.
Good, thanks, Andy. Is there a typical list of processes that your customers use ER Tracker to manage? You mentioned a few in your presentation. Is there a typical list?
Most common ones are probably disciplinary grievance, short and long-term sickness, bullying, harassment, and probably performance are the most, I use the word common, it's one of my icebreakers. They're not common, sorry, the most popular. They're not popular, they're common is my icebreaker that I normally use. So yes, slight play on words there, but yeah, they're the most common ones. MHPS, sometimes people want set up as well. It's quite a detailed process. And then quite often people like the idea of managing it as like a help desk inquiry case type, so they can start logging the informal interactions they have to start building up. Well, actually, we may have dealt with 50 disciplinaries, 100 grievances in the last 12 months, but we also had 800 inquiries about X, Y, and Z, so they can start quantifying it. And I relate it similar to recruitment. In recruitment, you may have recruited 200 nurses or new colleagues into the organisation, but of those 200 new recruits, you probably would have long-listed 1,600, shortlisted 800, and interviewed however many. So it's just building up, quantifying the size of what HR does day in, day out.
Okay, thanks. There's a comment in the chat saying that a dedicated ER case management team from experience works best to deliver and manage cases in this way. database system works best to monitor as well in that way. System development, though, is key. And often internal system setup is challenging. I've got sorry, go on.
What was that last bit? Sorry, I didn't capture the last sentence you said.
Often internal system setup is challenging.
Okay, yeah.
So it's more of a comment reiterating some of the things that you've said. So I've got a question. I do quite a bit of work around restorative just culture, and it's one of the elements in the people plan, about how you support people going through a process. So I'm curious to know whether you've thought about how your system might embrace that different approach that's the ask of the people plan. This is like doing fact finding before you go down any or consider any formal disciplinary route.
Sure. So one of the, during implementation, one of the areas that normally comes up as a discussion point is, what do people want to manage in the system? And the debate quite often centres around, do we want to list and log and track the informal element, or just start logging when it becomes formal? My view is typically log everything from day one from an informal aspect. So just because it's in the system doesn't mean it's formalised. So we would quite often have, say, in a disciplinary example we may have is an informal stage. And just by having the conversation with an employee saying, just to make you aware, this is maybe how you come across, or this is what we perceived has happened. By having that initial conversation and listening to what the employer's reaction is, they may say, do you know what, I had no idea how I was being perceived, or I came across, or how I conducted myself. I'm so glad you told me. Quite often that's the issue resolved, and it's just making people aware, just feeding back as best practice. So we would normally advocate having like the informal process to go through. And if only, the outcome of that, maybe the employee reacted badly to maybe having that conversation, maybe you realise actually we do need to go to another stage and start investigating the facts behind it. So the system can be set up and structured in any way that an organisation would like it to work, whether that's capturing the informal or not. Again, I would push for capturing the informal, because it also shows as an organisation, if we're resolving 50% of our disciplinaries informally, that's a really positive stat. So actually they're not really disciplinaries, it's just that's where they've started off as the first place. Another organisation that we work with, they capture the interaction contact points that they have with employees, colleagues that are suspended. So what they want to do is ensure that once a week that employee is communicated with, so they're not just left forgotten about and the employee sitting at home worrying about it. They are continually contacted, and there's board oversight in this organisation that look at how often you speaking to people, and they've got to log all their interaction points, maybe just high level what was discussed, maybe giving the employee an update of what's gone on in the last week since we last spoke. Even if there's much of an update, it's just a welfare call as well, not to forget about people and things. So again, it's being used differently, but for good reasons.
Thanks, Andy. That's really helpful. You mentioned in your presentation that you work with a number of organisations across lots of sectors. How many NHS customers do you have using ER Tracker?
I'd say at the top of my head, we're about 70 or so now using our tracker or so. So a really large number. We're really proud and pleased to have as customers, ranging from ambulance trusts, acute mental health communities, so touching all areas. Large number.
That's helpful. And I suppose a practical question, if an organisation was to look at implementing Selenity's ER Tracker, what's the process? What's involved? What does an organisation need to be aware of? Okay, so to start with the system's all built around your policies. So there's no major prerequisites involved, I suppose, from a system perspective. We would, I suppose, traditionally, no, maybe not so much this year, traditionally turn up at your doorstep and have a kick-off meeting on site, get to meet you, understand the requirements. Now, obviously, we're doing that virtually. So we will go through, start creating the structure to the system. So exactly as you just asked, Nikki, about dealing with things informally and before having to go through a formal process, we would say
What's the structure involved, for example, for your grievance, your discipline, your sickness? What are the main stages? And that's either policy driven or maybe how people want to work and be structured. What are the steps involved? So we'll go through and basically say, what does your policy say you need to do? If your policy doesn't stipulate the detail, how do you want it to be set up in such a way that you can monitor your progress to try and ensure that you're staying compliant with your policy? So we'll go through that process, building the structure into the system. They'll test the system, we'll make changes with them, and then go live. I appreciate it's such few words. That's how you implement a system. Sounds too simplistic, but complicated. What I'm trying to say is not complicated, and then it's all built around the user's requirements, around the policies that you have, the paper policies, to translate those into the system.
Great, thanks, Andy. And I suppose in this day and age, data and analysis and granularity of analysis is quite important. So just looking at the, does your system, can it report on cases in terms of the 9 protected characteristics, for example?
I think there's 6 standard protected characteristics, with the 3 other ones that can be added locally by organisations, but absolutely as standard off the top of my head, things like disability, gender, sexuality, ethnicity, religion, age, and then additional ones can be added and reported on as well. So again, it's obviously not quite, it's a very big thing in public sector, the ability to report by protected characteristics and demographics. So yeah, a fundamental of what the system can be used for there.
Great. Okay, thanks, Andy. Audience, please feel free to add any questions in this chat box. I suppose another question is the typical cost saving a trust can see through using such a system as ER Tracker. Do you have a quantifiable evidence on that?
We'd never say it's going to save you exactly this. Each organisation will have a way maybe of demonstrating what they could save. What we say to people is that yes, there's obviously savings to be made by working more efficiently. Maybe like the absence case I gave, they've got their return on investment just by managing absence cases. Some organisations 40% quicker to complete hearings. There's a time saving, but there's also a lot of intangible savings as well. So there's avoidance as well. So the intangible side, if you're hearing a case quicker, the employee has the benefit of the case being concluded quicker. So an intangible. Avoidance-wise, if we're hitting our policy timeframes, staying compliant with policy, well, hopefully by doing things we say we'll do and by when, we're hopefully avoiding ending up in an ET by not doing things as we said we would. So while it's not a direct saving, it's more of an avoidance. So I'm very mindful of saying it's not just savings, it's saving plus avoidance as well, and the intangible benefits. And if you're not ending up in an ET because you've done things correctly within time, your reputation as an organisation isn't questioned, and from a recruitment capability perspective, you want to be able to recruit people. But if you've got a tarnished reputation, again, that does maybe makes it slightly harder. So there's certainly intangibles that we talk about, as well as areas of savings and things like that.
Thanks, Andy. That's really helpful. I suppose the other question is just it'd be useful to know if line managers can use the system, or is it typically just your traditional HR managers that use the system?
Typically, organisations use it from an HR-centric perspective. It's not being used predominantly just by line managers. However, what I would say is there's certainly an appetite and a growing appetite to roll it out to line managers. So we do have a number of organisations. We've got one in the NHS specifically I work fairly closely with. They've rolled it out to 300 line managers who use it to manage the cases. So HR become a bit more strategic, and the line managers become a bit more hands-on. And often the line managers obviously a lot closer to the subject, the issue in hand. So they're the ones managing it. They've got their stages and steps, their template to follow, and then obviously HR's got oversight of what's going on in the organisation. So yeah, typically HR-centric. But from a system perspective, there is certainly a growing desire for organisations to roll it out to line managers as they're closer to the subject. So yeah, it can be used either way. And from a licensing perspective, there's no difference on the number of users either and stuff like that, which I think is an attraction for a number of organisations.
Okay, thanks, Andy. So we've got a question from Eileen Wedgwood in the chat. Does the system stand alone, or does it link to ESR, the electronic staff record?
Records. Okay, so we don't have a technical link to ESR to pull down employee information. We are on our roadmap planning process at the moment, and that's on the roadmap planning shortlist to go through to have a look at. But what our customers in healthcare do, there's an import process. They can import information out of ESR into a spreadsheet and upload it into ER Tracker. So it's not a lengthy or complex process to go through. It obviously is a process that needs to be completed, ideally at least once a month. But hopefully moving forward, we'll be in a position where we'll have a direct link to ESR to pull down employee information into ER Tracker. So one to four.
Alison's also put in that system can send prompts to managers as reminders of steps and KPIs that are reaching deadlines in the system. I don't know if that's a comment or a question, sorry.
I'll take it as a question. So yeah, it depends how the system's set up. It's probably the $1 million question. Depends how the system is set up. Yes, it can send it out. So if line managers are managing the case day to day, then yeah, they can get reminded to do overdue reminder emails telling them something needs to be done, something's gone overdue, and then you can have escalation emails to the line manager to say this case has gone overdue. So it's not trying to be Big Brother, it's just trying to improve visibility of information.
Thanks, Andy. Sorry, Alison, I realise it was a question there. Sorry. I'm not very good at this, am I? Okay, so that's the last of the questions in the chat. You said you had a couple more slides, and then we can see if there's any final questions before we close. So, Andy, over to you.
Okay, thank you. Let's see if I can get my... I'll attempt to get my screen on there, full size. Okay, so if people do want more information, please do head to www.selenity.com/ERTracker-demo or visit the website. We've got a lot of case studies as well, especially in healthcare, where there's people looking at the time that they've saved in reporting and other benefits. So please do have a look through our case studies. As Nikki mentioned, the HPMA at Selenity and CMP undertook research around the impact of COVID-19 on employee relations in the NHS. So again, you can come and download this from the website, Selenity. It's also on our booth as well. So if you go to the ER Tracker booth in the expo, you can download it. It takes you to a link and download it from there. And I believe we're setting up a panel discussion in January to look at this in more detail as well, which will be great. And then my last slide is just a little bit of, I suppose, marketing, just to say the booths we are exhibiting with at the virtual event today and tomorrow. The times that you see here at 12:20, they're all demos tomorrow at 12:20 for the 4 products there. So please do come by, say hello, or have a chat with everyone in the booths, enter our competition, and hopefully attend some of the demos. So thank you from me. I hope you all found it useful, or at least something to take away back to your organisations with to think about. By all means, feel free to drop me an email, andy.shettle@selenity.com. If you have any questions, thoughts, want to pick my brains on something, then please do. Otherwise, have a great rest of the day and tomorrow at the event, and speak to you all again soon.
Thanks, Andy, very much. And Harriet's kindly shared the link to the report in the chat and your email address. So if you want to contact you. But huge thanks to Selenity, and thanks, Andy, for your time this afternoon. I look forward to seeing you all again in the morning, bright and breezy. So thanks for all your engagement today. It's been a really good day. Thanks very much. Bye for now.